Aiden, go eat your food so you can get ready to take a shower.
It's not a wig.
Yes, it's a wig.
Ah.
Put your arms out. What? That hurt? Put that down. Put it down. I was supposed to be recording the video. I just do it live. I don't even like this wig. I was just trying. I just bought a new wig. And I guess I'm gonna start doing reviews for stuff I experiment in buying because this is not what it's not giving what it's supposed to give. I don't know if y'all can see the lace. Like they just rigged some stuff up, like they made a mistake and they just decided to just add something here and just sticking out. And then so what you gotta do? Cover this up. Like you can't be rocking this with this right here like this. And then on this side, did the same thing. It would make it so bad. This is one of the more expensive wigs. Like, what the hell that y'all decide y'all was gonna do? But yeah, I'm gonna start doing reviews on these people. Just taking people money. Cause I don't know what this is. It's a hot mess. Hi, Rashika. Everything's going great, thank you. Well, I know. I tried to send another one I purchased back, and it's not even giving me a way to send it back. So I guess I have to send an email so I can send it back. This one I end up cutting on, trying to fix it, and so this one I can get away with. I just have to cover it up. Like what is that? Like seriously, I can't wear this back like this with these things on here. Y'all tried that. I'm gonna tell them about themselves though too. I'm gonna email them about this one because this don't make no sense. And I'm gonna tell them, I'm gonna do a review on they crap. Like, come on now. I bought one. It was perfect. And then now, every time I wear it, it stretches. The lace stretches. And I have to... It's a mess. Spend too much money. How long will it take? Who is hot? Hold on. I don't know if I just got angry or if I'm having a hot flash.
It's MasterCard. Round 19 tests your eyesight. Can you find the MasterCard logo in 5 seconds?
MasterCard. That's your credit card. MasterCard logo.
I want the card made.
It's a card.
Round 20. Do you know what logo this is?
Card.
No.
Mommy just got super hot.
It's Chevrolet. Round 21. Guess the logo by illusion.
Excuse me, sir. You go sit down and eat so you can take a shower.
Toyota is correct answer.
Okay, I just had to come off them clothes.
Can you guess which logo will go?
No, I haven't started the DMP program. I'm nowhere near even thinking about starting the DMP program right now. Not in the mind space for the DMP program. It's just not on my to-do list right now. Right now, I'm just want to do these health risk assessments and try to figure out what business I'm going to start. And that's my plan. The DMP, I mean, I thought about the DMP the other day. I was like, I should go ahead and enroll with Capella, but I didn't think about it twice. I do have the time, so, but I haven't put any more thought into it. But I will. Just right now, I'm not doing it. I need a break. I kind of like being at home after work and just having a life. Turn that down a little bit so I know once I start the DMP program, I'll be doing homework after work. And once again, I won't have a life. So everything I've done was accelerated all the way from LPN to post certificate with the psych MP. Everything was fast paced. The LPN program was 12 months in Toledo. The Excelsior program is supposed to have been a year, but it ended up being 2 years. But I was done. Only had the 8 or 7 or 8 nursing classes to test out of. So I got done with that in less than a year. And then I was on a waiting list for the out-of-town clinical. Then I failed the first one. Then I went back a year later. And so that took longer than I expected. But so I after that, after Excelsior, I did Capella, which was 8 weeks. I got done with that in 8 weeks, accelerated. Then I started Purdue F&P, 16 months accelerated. And then I did post-certificate psych nurse psych MP, 1 year. So I was I'm a little burnt out. I haven't, so that, what was that, 2000 and, let me look at my degree, see real quick. So 2015, 2015, September 2015 was the LPN program. So September 24th, 2015 was the LPN program. And then September 24th, how was that? September 24th, 2015. Oh, that's the same. Okay. Was the LPN. And then, no thank you. And then I went to Excelsior College and I graduated. When was this? February 2020. was Excelsior, and then Capella was July 34th, 2020. So I got done with Excelsior February 2020, and then graduated Capella July 2020. And then the F&P, what year? February 22nd, 2022. And then Site, March 14th, 2023. Did you guys hear me? Did you guys hear me or no? I tried to talk loud. I got everything in a little case over there. So I hope you guys, bottom line is everything was accelerated, and I started in 2015. I'm looking at my degrees. So from 2015 to 2023, I've been nonstop going to school. So I'm a little tired. I'm not really enthused about the DMP program anyway. And most of you guys know that the only reason I really was thinking about it is because so people can refer to me as doctor, but people already refer to me as doctor. And your friends and family, little haters, they'll never call me doctor. So I'm just talking. So Rashika, where you been? I'm doing a health risk assessments. Hey Felicia. Hey Polyglot. I'm doing a health risk assessments. Okay. Aiden, somebody FaceTiming you. So I'm doing a health. So really, I'm working from home today doing tele visits, and my next visit is not until 3 o'clock. Well, it's coming up. So I had 30 minutes. So I decided to last minute go live, which is what I'm doing. And so, hey.
You're making another one. Huh? Just roll the fruits back.
Hey, Miss Lady. Oh, thank you so much. Let me see. I was gonna go over real quick a sample. Well, not a sample, just real quick over. So how I do the home visits. I mean the tele visits. So open up the chart. I read a consent. Let them know that for the family and psych, yes. But I didn't solely use the purple book. If y'all looking at my wig, I already talked about this in the beginning. It's a hot mess. But I'm gonna start doing reviews on stuff that I purchased and it don't work out. Yeah, I did the purple book and I did a review, 6-week review also. And I'm going to do a video on that. So last 2 videos, remember the video you're explaining the good pay for health risk assessments. Yeah, I do the health risk assessments. I do them from home, and then my second job, one job I do the health risk assessments from home, and then the other job I do the health risk assessments in the field. I go to different people's homes. So at home, so I pull up the chart. I read the consent to them, was basically saying, I'm contracted through your health insurance company to complete this assessment. Not going to diagnose you with anything. For this does not substitute a visit to the doctor's office. The purpose of the visit is to review and assess your health status, and I'll go over your medication. If you're taking anything, I'll ask you some health history questions, and that'll conclude our visit. You'll get a copy of this assessment in the mail, and your doctor will get a copy. Primary healthcare provider will get a copy also. Do you give verbal consent to the visit? Yes, blah, blah. And do you have any allergies to medications? Blah, blah, blah. I have a list of medication here for you. I'm going to go through. You let me know if you're still taking the medication or not. And once I go through the list, if you're taking something that I did not mention, let me know. Okay, go through that. So then the patient understands the visit. Do they have any issues that need to be addressed today? Was a translator used today? What's the location of the visit? I'll put tele visit. Did they provide verbal consent for the visit? Did the member verbally acknowledge receipt of notice of the privacy practice? So I asked, what's your primary care provider name? Do you have their number? Do you have an appointment coming up? Are you receiving care from anyone else, like a cardiologist, psychiatrist, anything like that? Do you have an advance directive for a living will, power of attorney? These questions about your mother, father, brother, sister, grandparents. Did any one of them have a mental health disorder, abuse, drugs, or alcohol, high blood pressure, diabetes, heart attack, stroke, or cancer? Do you drink alcohol? Do you use marijuana or any other substance? Do you currently or in the past have you smoked tobacco? How many days a week do you work out or walk for 30 minutes a day? In the last 6 months, have you been to the hospital? If so, how many days did they keep you overnight? Did you get the flu vaccination last year? Are you required to get the pneumococcal vaccination? Are you up to date with all your immunizations? Have you had any surgeries in the past? Do you wear a vehicle? Do you use a seatbelt when in a vehicle? On a scale from 1 to 10, how confident are you with understanding why you take your medication and taking it on time? Where 1 is not that confident and 10 is the highest. Are you able to bathe and groom yourself with assistance at home? Do you need additional assistance with shopping and housekeeping, managing your finances, getting to and from doctor's appointment? In the last 12 months, have you worried about losing your home or running out of food?
What is in this top?
You have a fruit snack. Can you tell me how much you weigh? Can you tell me your height? Are you in pain right now? Do you have fatigue or weakness, unexplained night sweats or fever? In the last 6 months, have you had unexpected weight loss? How many meals do you eat a day? 1 or 2, 3 to 4, or more than 4? Do you get frequent headaches? Have you ever been told you had a problem with your eyesight? I'll just ask, do you have cataracts, macular degeneration, or glaucoma? Do you have any issues with your hearing, mouth, or teeth? Any respiratory issues, asthma, COPD, emphysema, chronic bronchitis, any shortness of breath, coughing or wheezing? Do you use an oxygen device? Do you have sleep apnea? Cardiac. Do you have any chest pains, chest discomfort, chronic heart failure, cardiac disease, swelling in your ankle, legs, or feet? Ever had a bypass, a stent, pacemaker? You've been diagnosed with high blood pressure, high cholesterol. Okay, go over there, Aiden. You've been diagnosed with high blood pressure, high cholesterol, vascular disease? Do you have issues with blood clots reoccurring? Do you have frequent nausea or vomiting? Do you have heartburn or indigestion, mucus or blood in your stool, diarrhea, constipation, frequent pain in your abdomen, Crohn's or ulcerative colitis? Do you have hepatitis or liver problems? Do you sometimes accidentally leak urine or feces? Do you have an ostomy? Do you have issues with reoccurring urinary tract infections? How many times do you wake up out of your sleep to urinate? 0, 1, more than 1. How many falls have you had in the past year in which you had to go to the hospital? Do you have muscle weakness? Have you ever been diagnosed with arthritis? Do you have limited range of motion in any of your extremities? Do you get dizziness or have dizziness or vertigo? Burning, numbness, or tingling in any parts of your body? Hand tremors? Have you ever had a stroke? Have you had a TIA? Does anyone ever say, I'm concerned about your memory? You should get it checked out. You might have early Alzheimer's or dementia. Have you ever been diagnosed with any neurological conditions, neuropathy, multiple sclerosis, seizures, epilepsies, Parkinson, Huntington's? In the past 2 weeks, have you been depressed or suicidal? Have you ever been diagnosed with anxiety, depression, or any other mental diagnoses? Do you have a history of suicidal attempts or ideations or self-harm, such as cutting? Do you have diabetes? Are you hypo or hyperglycemic? Do you have any thyroid issues? Are you anemic? Do you have hemophilia, which is a blood clotting disorder where your blood doesn't, if you get a cut, your blood doesn't clot, you have to go to the doctor, so the hospital, so they can stop the bleeding. You have HIV. Have you ever had a transplant? Have you ever had cancer? Do you have any issues with your skin color changing? Do you have any rashes, open wounds, or amputations? Okay, next. Have you had a diabetic eye exam in the last 12 months? Have you had a colonoscopy in the last 10 years? Have you had a mammogram in the last 2 years? Have you had a bone density test? Have you, I think that's it. You understand the importance of eating healthy. You try to eat healthy. You understand the importance of seeing a dentist every 6 months. You understand that they want us to work out or walk for 30 minutes a day, 30 minutes or more, 3 times a week. Do you have Medicare or Medicaid? And that's the assessment. So if you were at a patient's home, you would have to do a physical exam, the eyes, the ears, nose, throat, the neck, listen to the heart, listen to the lungs, listen to the stomach, note as far as their muscles, normal gait or not, neurologic, any tremors, pain, alert and oriented, psych, calm and cooperative. Okay, and then you have to get the temp, pulse, respiratory rate, pulse ox, blood pressure, and you get the weight and height regardless. So that's that. Okay, you're doing the Lord's work, sis. Thank you. Really, this is easy. No diagnosing, no prescribing. No diagnoses, no prescribing. If you know a lazy nurse, a lazy nurse practitioner, this is the job for them. I'm not a lazy nurse. I would just tell people all the time that I'm the MP or the RN, whatever. I'm the employee that's going to go to the job and I'm going to do what I have to do. My required, they have your details, job duties as a MP or RN or LPN, what you're supposed to do. I'm going to go in there and I'm going to do my job duties. Like I'm not there. I'm sorry. I'm not there to try to get employee of the month or anything like that. That's not what I'm there for, because at the end of the day, I know y'all would fire me at the drop of a dime. Y'all would write me up for something stupid. So I'm not that employee. So like I said before, when you get in the field, when you get done with school, don't get stuck on one type of job. Do get a year experience in as many fields as you can. If you can get in cardiology, if you can get in wherever you can get, med spa, clinic, health risk assessments, whatever you get into, just make sure, just try to do different things until you figure out what it is you like. And I found that I like health risk assessments, and this is what I'm going to do until I start my own practice. So until then, that's that. I'm still going to stay educated, whatnot. I'm going to go to conventions. Like in May, I'm going to, the end of May, I'm going to Vegas to the psych convention or whatnot. So I'm going to stay up to date on everything, but I'm not going to be working in psych right now. I'm just doing this, and psych or family can do what I'm doing. And it's good, it's easy. You have a life, you make your own schedule. If you have to last minute cancel for some reason, you just cancel, no questions asked. It's just what I found to be what works for me. It is what I found where, like I said, I don't miss out on anything with my son. If they call me out and tell me I have to pick my son up last minute, I don't have to wait to for no manager approvement, and they telling me I gotta wait until they can get somebody to come in for me. All that BS. I call and say, hey, clear my schedule for the rest of the day, and you don't have to give a reason. So it's it's the best thing for me, and like I said, I make great money. So why would I? I'm currently working for a. Sounds like what the RNs are doing at my job. You currently work for what? MALTC. I don't know what that is. Exactly. It's the same assessment that you do. You're just going and to people homes, or you doing it over the phone, and you getting top dollar for it. So it's easy. It's easy peasy. So let's see if my 3 o'clock is going to join or not. I'm gonna see if my 3 o'clock is going to join before I end the live, because if they don't join, then I'm not going to end it. Hi, this is Angela. Hey, are you able to log in for your health risk assessment with your insurance company? Okay, so just click on a link, and then I'll join you. You got the link in your text message or email? I'll hang up and I'll send it to you again. So it's going to come to your text message, okay? All right. So I don't know. Today we've been having issues. I've been having issues with audio. So I haven't really seen anyone today. Only seen one person out of 1, 2, 3, 4, 5, 6 because of audio issues. So I hope this works. Let me send him a new link. Let's see if this works. Okay, see if he joined. Yeah, the company that I work for. So, if you're interested, just give me a text and I'll get you hooked up with my recruiter. Oh, there he is. All right, so 248-842-2662. If you're interested in the health risk assessments, just shoot me a text, and I'll get you hooked up with my recruiter. All right, well, I'll see you guys Tuesday, unless I do another last minute live. Thank you. Bye-bye.